Hello and welcome. My name is Michelle Moser, and today we are going to talk a little bit about SIBO, SIFO, and beyond that. So let's get started. We're going to talk about things that are not necessarily approved by the FDA, and this is information only. So please seek out medical advice when necessary. And I will be talking a little bit about compounded medications as well. Primary objectives for today is to define what is SIBO, what is SIFO, what's the difference, and how in the body does this dysbiosis become an issue. But then we're going to talk a little bit about the therapies that can be used to support gut dysbiosis. Well, what is SIBO? That's small intestinal bacterial overgrowth. And there's a wide variety of symptoms that are associated with SIBO. Here's a few that I pulled from PubMed, specifically bloating, abdominal pain, constipation, diarrhea, belching, flatulence, nausea, fatigue, brain fog, and even fatty stools. But there's even more that can be associated with that because, as we know, the gut is a very fragile thing. It's the inside lining of the intestinal tract, starting in the stomach, is only one cell thickness deep. So when that becomes disrupted or changed, a wide variety of even natural metabolites can seep through, escape into the periphery, and cause a wide variety of other problems. So sometimes people will even present with dermatology issues or with foggy thinking or lack of mental acuity, even depression and anxiety. And a lot of times this has to do with intestinal bacteria not being in proper balance. We can test for SIBO. There's a wide variety of ways to do this. There are the breath tests where we're going to measure hydrogen and methane, and that will help us determine what pathogens might be available and visible. These are non-invasive tests, right? So this is something that can be done even in the privacy of someone's own home or within the provider's office. And we know that when certain bacteria, certain pathogens, or even fungus, as we're going to get to next, when that is allowed to overgrow, it squeezes out some of the good guys. And so the balance between the good and the bad, and maybe even the ugly, isn't necessarily the best for overall health. There are some stool tests that are available as well that can accurately identify what is happening in the gut, usually from the oral cavity all the way through, so that we can then make diagnoses and differentiation between treatments. So this is one of the gut tests that are available. It is a complete DNA sequencing of what's happening in the gut. BiomeFX gives you about a 20+ page test result showing deficiencies, surplus, pathogens, even what's happening with micronutrients, which is very important because micronutrients can cause malnourishment and even some other disruption in other places of the body. When we're able to identify exactly what's there and what's not there, then we can predict what is happening with other chronic disease. We can also then try to fix it. This is showing one of the pages from the BiomeFX tests where it will go over gut biome index, the diversity of what the gut biome is looking at, as well as any pathogens, any keystone species that are out of range, either too high or too low, as well as those functions. So what is happening with the end byproducts that our biome is supposed to be producing for us? So how are we taking in our nutrients, using those nutrients, breaking those down to then form those end products through metabolism, a wide variety of metabolism and different pathways that will help us to have better thyroid function, happier mood. Maybe it even has to do with stabilization of blood glucose, let alone the absorption of our micronutrients. Very important. So there's a lot of treatments for SIBO, many of which are over the counter. Some of them, most of them are professional products as well. And there are some things that patients can do right away to help move them on a better path toward health. We can identify different diets. Sometimes we want to take a look at an elemental diet or elimination diet so that we can take away some of those foods that are fermenting irregularly or actually causing sensitivities or irregularities in the gut or in the lining of the gut. We can look at probiotics. We can look at the prebiotics to help feed those probiotics, and a wide variety of herbs to kind of calm the area. So whether we're following the 4 R's of removal, restoration, repair, and replace, or we can jump right in and look at the very specific herbs to correct those things. There's a wide variety of micronutrient deficiencies that need to be addressed as well, because when we don't have the right level or the right mixture of nutrients, that can lead to other chronic health issues as well. Whether we're dealing with muscle spasms, depression, anxiety, we could also be other digestive disorder. And we certainly don't want that to lead toward Crohn's disease or ulcerative colitis or mast cell activation syndrome. We don't want that to then go into cardiac issues or move into respiratory issues or even cross the blood-brain barrier and cause significant problems. Usually, it's going to take anywhere from 3 to 12 months, perhaps even longer, to correct what is going on. Sometimes there is some trial and elimination process that needs to be used in the meantime. And that's because sometimes when we're trying a very specific treatment pathway, we might uncover or develop other issues that need to be addressed. So we might try something for a while and then something else pops up and we need to get into other treatments. There's also some side effects where patients a lot of times will drop off. So sometimes if they get more gas and bloating than what they initially had, they need to be forewarned that that can happen with a wide variety of treatments, because the die-off a lot of times is troublesome. They can have that rumbly in their tummy, the bloating, the gas that either escapes through belching or flatulence, and that can decrease patient compliance. But there's a variety of compounded medications that we can use to improve patient outcomes as well. So when we're trying to support the resolution of SIBO, we need to take a look at biofilm disruptors to then help with our therapies to be absorbed, but also then to actually break down some of those bad bacterium or bad fungus or pathogens that we need to allow to move along and be excreted from the body. Sometimes we're using bismuth, alpha lipoic acid, dimercaptosuccinic acid, which will also help toxins, heavy metals, and that sort of thing to escape the body. N-acetylcysteine, which is NAC, precursor to glutathione, which is a master antioxidant. Cinnamon, ginger, cranberry, curcumin, oregano oil is great. Oregano oil has a wide variety of application that we'll talk about pretty soon here. Coconut oil, whether we're talking about monolaurin or lauric acid, all of that can help to reduce inflammation, but also help with the treatment and the resolution of SIBO. Specifically, when we're looking at herbs, whether it's wormwood or black walnut, even some of the natural products such as apple cider vinegar or ascorbic acid, vitamin C. Usually it's a combination thereof that is going to be helpful. Most of these products can be compounded with, but many cannot. And there's a wide variety of dosage forms that are available as well. Sometimes we're using oral capsules that then dissolve with plenty of water. Then we use that very specific times of the day that can be released into the gut. The stomach will then utilize that and move it along the GI tract. Most of this is not systemically absorbed. Some of it can be. So it really depends, again, on how good the gut is in absorbing these issues or these different elements. We don't really know that just by looking at the patient. Again, we can look at tests to identify what needs to be used. Now, when we move into SIFO, so SIFO is small intestinal fungal overgrowth. So a lot of times the symptom list of SIBO is similar to SIFO. So how do we determine one or the other? Because treatments can be similar, but they could also be very, very different. So it's not uncommon that SIBO is the bacterial overgrowth is treated, and then we actually find that maybe 3-6 months down the road, maybe even a year down the road, that everything still isn't resolved. Well, then we can jump into treating for the fungal overgrowth, whether it's Candida or some of the other fungal pathogens. And a lot of times too, we're dealing with spore formers. So if that's the case, that's going to take a longer period of time to treat, because you've got to be able to get at that fungus or that yeast in all of the phases of its growth and turnaround. So the biggest difference is that you will see some nausea and some flatulence, belching in that, but usually there's more nausea with SIFO than there is SIBO. Now, the fungal overgrowth can be due to low stomach acid, just as the bacterial overgrowth. Antibiotic use, again, can be causing SIBO as well. Stress can absolutely trigger a bacterial overgrowth or a fungal overgrowth. And that's because cortisol goes up, which allows sugars to be dumped into the gut. And that also changes our diet and things like that. And our gut response is going to be very different under stressful situations than at normal. Anytime we have a slower gut, so we're actually moving things through the gut slower, we can actually have a greater trapping of pathogens and overgrowth. And excessive sugar and alcohol consumption can feed more of a fungal overgrowth than a bacterial overgrowth, although it can happen with bacteria as well. And anytime there's a compromised immune system, we can have both bacterial and fungal overgrowth. Fungal overgrowth tends to be much more specific in immune system compromise. And the concern is that we want it to stay localized. We still want to be able to treat it and eliminate it. But anytime it becomes systemic, that can be very, very troublesome. Fungal overgrowth in the small intestine can have an impact long and far and wide, even past the GI tract. Usually that fungal overgrowth can develop on the skin as well. We've seen that with a wide variety of psoriasis, where you actually see it developing on the skin, chronic yeast infections in the vaginal tract, but also in the rectum. You can also see it in the armpits, and where skin tends to fold over and trap heat. You can see a wide variety of itching, again, psoriatic plaque. Toenail fungus, for example, is a fungal overgrowth. So we're not necessarily always talking about the overgrowth that is trapped within the gut, but can definitely escape into the periphery. And the medications that we use for toenail fungal overgrowth can be compounded to a much greater success than what we see with the commercially available product. And a lot of times we can combine medications such as fluconazole and ibuprofen and tea tree oil and put that in a liquid form so it can be painted on the nail, be absorbed right there, and actually trap and kill that dermatophyte that's actually sitting underneath the nail. Anytime that we see a white coating on the tongue from thrush, either through steroid use, inhaled corticosteroids or oral corticosteroids, antibiotic use as well. So anytime that thrush is here, it could be in the sinuses, it could be in the ear canal, could be anywhere in the eustachian tubes, but also as it travels on through the body. The bottom line is we're just a donut. We have a hole that transcends all the way through. We got to treat that donut hole, but in order to really be able to treat that donut hole, we got to be able to identify what exactly is going on. Now, the vaginal tract and the bladder are not necessarily directly connected to the GI tract, but again, they're only within a very small distance away. And so it's not uncommon that these pathogens can leave the rectum or develop on the skin and actually infect other areas of the body, other cavities, such as the vaginal vault and also in the bladder and urethra. So sometimes those symptoms will show up there, and yet we need to treat the gut as well. We don't want this inflammation to escape and cause deficiencies in micronutrients. Can also cause weight loss, which for some people, they think it's wonderful, but other people actually gain a lot of weight because the body recognizes that to dilute pollution, a lot of times you have to increase that pool. So the solution to pollution is dilution. And in order to do that, you need a larger vessel to cause that dilution. And it often isn't necessarily the primary bacterium, fungus, or pathogen. It often is the metabolites and other disease states that follow that are causing these issues. Again, we can use the Biome FX test. There are also other GI effects tests and other GI tests, again, collecting stool to look at overall health and the balance in the digestive tract, to measure the microbiome and the microbes, the other health markers, so that we can treat and then retest in 3 to 6 months to see where we're at, and then again continue to develop those treatments as an individualized approach to find best success. Now, when we're looking at a complete DNA sequencing of exactly what's in the gut, it does give us a really good picture so that we can identify what is needed. When we're looking at treatments for fungal overgrowth, there are some traditional commercially available products such as fluconazole, itraconazole, posaconazole, and those all are very effective against Candida and the various strains. We also have some older medications such as nystatin, which are very effective as well. Now, what's interesting is that a lot of commercially available products, especially nystatin liquid, contains sugar, which is counterintuitive because we don't want to feed the fungus, we want to eliminate the fungus. So that's where compounding of medications can be your best friend and your best bet. Because again, as a functional medicine provider, I want to make sure that the provider, the healthcare prescriber, is the one that is the hero here, because a lot of times patients have bounced between provider to provider, maybe even spent years, if not decades, trying to identify what's going on. And so they land on your doorstep. And if you're able to actually come up with the right mix of things to treat them, given the understanding that it might take several months or a year or so to actually get through the treatment process, but anytime that is identified up front so that there's clear understanding as to what is exactly determined along this pathway. That way, the objectives are clear, the end results are clear, the timeline's clear. So there aren't any misconceptions as to what should be assumed the treatment should be and how quickly it should happen. That's only going to increase patient compliance and better patient outcomes. Of course, we can still use really good probiotics, a wide variety of herbal antimicrobials, oregano oil, garlic, berberine, really help with the treatment of different types of fungus. Sometimes we're using these in combination with bacteriums. So we might use antibiotics along with probiotics that help cure fungus issues like Saccharomyces boulardii. So when we're looking at probiotics, there's a wide variety that have really good mixtures of beneficial bacterium that combine with the SAC-B to help prevent fungal overgrowth. We also need to take a look at betaine or apple cider vinegar to change, not only change the pH, but also with those enzymes, stimulate digestion in a more appropriate manner and replace some of those digestive enzymes that might be lacking. That way we can improve stomach acidity. We need that to be closer to a 1. When it's not close to a 1, then we see changes in the biome, again, leading to bacterial overgrowth, fungal overgrowth, and even other issues. Of course, when we improve stomach acid, we're going to have improved mobility and digestion. Of course, we can look at other herbals such as ginger and angelica root and chamomile, caraway. And a lot of times these herbs and vitamins and nutrients can be combined in a wide variety of products. That is going to help with patient compliance too. There usually has to be some dietary changes. People can't continue on with their current diet because that current diet is actually contributing to what got them to where they're at today. So we need to take a look at a FODMAP diet, the fermentable oligosaccharides, the disaccharides, monosaccharides, and the polyols. Perhaps they need to look at something that is gluten-free, perhaps dairy-free, or even identify those foods that they are allergic to that are increasing inflammation in the digestive tract. Some people even just look to a Mediterranean diet, one that is, again, very easy to follow, gives a nice variety of vegetables and very specific meats, and a wide variety of oils as well. When we compound, we can a lot of times combine different medications, but we can also deliver a dosage form that is going to be successful for that patient, whether it is a flavored oral suspension or a troche or a capsule. That a lot of times will identify what is convenient and much easier for the patient to use. Anytime that we can do that, we're going to see better successful outcomes. Many times compounded medications are less expensive than their commercial alternative counterparts, but we're also seeing that there are fillers in tablets and capsules that are commercially available that might actually be counterintuitive or feeding the process where we're actually wanting to negate that. And I'm talking about fillers such as lactose and sugars. We do see that can change things. Magnesium stearate, which is often used as a whitener or brightener on a tablet or in a capsule, can actually change the gut biome and how things are absorbed. So when we compound, many times we can leave out those fillers, use fillers that are considered inert and perhaps not as impactful on the digestive process. Now, here's a topic that a lot of people just don't want to go to. Parasites are absolutely a thing. And the World Health Organization, we're saying as of January of 2023, that perhaps 24% of the worldwide population is infected by different species of parasitic worms. Now, these worms can come in, they can be inhaled, they can be ingested, they can be brought in through the skin, through the eyes, through a wide variety of ways. They can burrow under the skin and then get into the bloodstream or digestive tract as well. Sometimes it's in the water, sometimes it's in contaminated soils. Sometimes it is traveled by a bird that is leaving droppings on foods and other crops that maybe are not washed before they're consumed. But that can also be due to poor hygiene, whether someone is not washing their hands on a regular basis and they're transmitting their own fecal material or their own urine material to them, reinfecting themselves or to other people as well. So that can also happen through coughing and even talking as we spray our saliva. So these parasites can be in very, very small numbers, but can dramatically replicate over a short period of time. And that can lead to changes in digestion, which again, that very generalized list of symptoms, the bloating, the fatigue, the flatulence, the lack of energy, depression, even anxiety, or not being able to gain weight, but are hungry all the time. Sometimes that can have to do with a parasite. Parasites can also be identified through testing. However, testing can be a little bit more tricky when we're looking at stool because parasites often are at different stages of their development as well. So are they in an egg form versus an immature adolescent or an adult? And it also depends on where they're being tracked in the stool or in the digestive system. Sometimes they don't necessarily stay in the digestive system. They might actually end up in other organs as well. Some people have actually seen kind of wavy particles moving through the different areas of the eye, and that can be a parasitic worm. Parasites aren't always worms. Sometimes they are amoebas or protozoa, and they can also have dramatic impact on our ability to digest foods and utilize our nutrients as effectively as possible. Viruses are a thing. We've just come out of the last couple of years where we've seen a wide variety of virus come and go, change, replicate, and those are things that we just deal with on a regular basis. But these viruses that we're seeing more and more are sticking around in the gut. They are disrupting the gut. They're causing a wide variety of vasomotor issues. Those symptoms are associated with lack of muscle tension, a wide variety of aches and pains. There's also a wide variety of symptoms associated with depression and anxiety, even being able to function normally with basic metabolic organs, such as our heart and our lungs and our thyroid, and disrupting our hormones. Even vaccines, which are usually attenuated or dead, can still cause dysbiosis. Sometimes using vitamin A and vitamin D can support proper development of immune responses as those vaccines are being given, which can minimize some of the symptoms associated with the use of vaccines. Some viruses can run and hide, only to rear their ugly heads at the most inopportune times, usually under stressful events or stressful situations. So what we've learned is that there are a wide variety of natural medicines, allopathic medicines, as well as combination thereof that we can use to help treat some of these chronic conditions and symptoms. So how to test for parasites. Sorry, this slide got out of order. So we can look exactly where those parasites might be. Again, they can be found in various development over months at a time. So sometimes we need to perform those tests every 6 to 8 weeks to try to find exactly where they're at in that development. When we look at treatments for parasites, again, there's a wide variety of natural remedies such as wormwood, garlic, which is allicin. The digestive enzymes come into play here, olive leaf. We can look at oregano oil as well. Black pepper, specifically piperine, and maslinic acid, onion bulb extract. But we can also combine those herbal medications that are available over the counter or through professional wholesalers. And sometimes we might need to use allopathic medications, whether we're using ivermectin, albendazole, or mebendazole. A lot of these medications have been around for a long time. We can also compound these so that we can look at a very specific dose for the individual that's in front of you. Or if we need to make an oral liquid because maybe somebody can't swallow a capsule, or you're dealing with a younger individual who is not able to swallow capsules, we can usually make oral suspensions for those as well. But when we move beyond the gut, it's not uncommon that the bacterial overgrowth, the fungal overgrowth, even parasites, and especially viruses, can change skin. So that can develop a rash, which can develop into itching or the feeling of creepy crawly. Sometimes we can see breaking of the skin. We can see pustules. And that's where they may present with a rash or an itch, but it really is focused elsewhere in the gut. Mental health is very much affected by a gut dysbiosis. About 90% of our serotonin is made in our gut. So if we don't have enough of our happy hormone, what exactly is going on? But we also know that the gut makes the medium chain fatty acids that our brain feeds off of. So we need to make sure that the brain is well nourished, but if our gut is not healthy, that isn't going to happen as well as it should. And we also know what happens after you eat a big turkey dinner, right? So that tryptophan makes us sleepy. We eat certain foods or we drink certain beverages, and it can actually change our mood. It can change the way we interact with people. It can change our productivity. Immunity is made in the gut. That is something that science has shown us over decades of work. So if our gut isn't happy, our body won't be happy. And that's where patients are going to arrive in a provider's office, where this can be a generalized long laundry list of symptoms, but sometimes with very careful expectations, we can line out exactly what can be done, and we can just slowly click these off. Of course, there are high risk factors. Chronic disease such as hypothyroidism can slow down the gut motility, can actually change the way the gut will absorb nutrients. Many times individuals with low functioning thyroid, whether it's autoimmune derived or not, do have slower gut and lack of ability to absorb. Diabetes, sugar running through their veins and arteries is absolutely going to change what's going on in the gut. Sometimes the lack of Akkermansia, which is a very healthy bacterium in the gut, if we don't have enough, we're not able to break down our carbohydrates appropriately. I mean, this is how metformin works. It works directly with Akkermansia. You don't have enough Akkermansia, again, bacterial changes in the gut, we're not going to be able to assimilate our carbohydrates effectively. That can raise our blood glucose levels. Parkinson's disease, again, there's motility issues. Any type of chronic viral infection, even scleroderma, and the list goes on and on. And the reason is because the gut really is kind of our second brain. So we need to make sure that it is well cared for. Most of the time when we're trying to effectively treat chronic illness, we need to fix the gut first. So let's talk about how to do that. So Methylene Blue is a long-term, very old medication. It was originally developed in the Industrial Revolution as a dye for fabric. So it is a hormetic dose response. And what a hormetic drug is that a drug will work differently at different dose range, high dose versus low dose. And in doing that, a lot of times we can see effectiveness in the body at different ranges. There's a wide variety of drugs that have hormetic dose response changes. So Methylene Blue works to reduce inflammation. It reduces oral mucositis and a wide variety of gut endotoxins as well. It can also reduce pain, which again are usually sometimes what we would call systemic symptoms associated with a dysbiosis. It's usually dosed anywhere from maybe even a 0.5 milligram to up to 2 milligrams per kilo per day. So I will say the average dose is somewhere between 5 and 15 milligrams a day. And we can use, I've even seen research done with single doses of Methylene Blue, such as 15 milligrams for depression. So if somebody presents with anxiety and depression, sometimes you could offer them a 1 or 2 time medication, and again, inexpensive to do that in just a few doses, and help treat a lot of the symptoms while you're working on the root or the functional issue. Those foundational concerns, once they're addressed and we can find therapies to treat those, a lot of times these ancillary symptoms disappear. With methylene blue, we need to be very, very careful to watch for impurities. We want to make sure that we are dealing with a pharmaceutical grade of methylene blue because it is used in a wide variety of other chemical industry. We don't want to use those forms. We don't want to use anything that's going to share impurities because sometimes those impurities are heavy metals and we don't want to infect the body with heavy metals. We also don't want to use methylene blue in babies, pregnancy, breastfeeding, or simultaneously with SSRIs. So if somebody is presenting with depression and we want to use methylene blue, we need to make sure that we are screening for drug interactions as well. And there are other drug interactions that are not listed on this slide. We can also look at low-dose naltrexone. So again, another hormetic drug. Naltrexone, when it was first founded and FDA approved way back in 1964, at traditional doses of 50 to 300 milligram, we were using naltrexone for alcohol overuse syndrome. We're using it for methadone overuse. But since mid 80s, we have found that when we use naltrexone at very low doses, sometimes microgram dosing up to milligram dosings, we can actually see something very dramatically change. We do not see the liver impairment. We don't see the liver changes with low dose. But what we do see is that even with low dose, microgram to milligram, up to anywhere from, let's say, 0.1 milligram up to maybe 8 or 9 milligrams, we can still reduce inflammation by blocking the cytokine production, interleukin 6, 12, etc. It will block toll-like receptors 4, 9, and 10, as well as many others. And what happens there is that you're actually moving the pro-inflammatory processes and reducing inflammation. So whether it's the itching in the skin or you're blocking the toll-like receptors to reduce tumor growth or actually block that chemical production at the mitochondrial level so that you can impact every cell. And that's why this medication, especially low-dose naltrexone, can work in a wide variety of disease states, because when you have a medication that can work foundationally at the cellular level, it can apply to many, many, many diseases, because most disease is founded in inflammation. Small intestinal bacterial overgrowth is usually an inflammation of the gut lining, whether that's due to bacteria or SIFO due to fungus, or you've got parasites causing more inflammation. We can also upregulate endorphins because, again, those receptors are blocked. So then the body will make more endorphins. And we see that anywhere from 8 to 18 hours after the low-dose naltrexone dose is given. That can reduce pain associated with a variety of issues. It will also intermittently block the opiate receptors, which are also in the gut. So sometimes when we give a low-dose naltrexone dose, people will complain about constipation, or it will change the motility, and that's intermittent, but it's also self-limiting. It's very short-lived. So we can see that those opiate receptors are blocked not just in the gut, but also in the periphery. So when we have a small intestinal bowel overgrowth, or that due to bacterium or fungus or parasites, unfortunately, that can often lead to ulcerative colitis, Crohn's disease, a wide variety of other autoimmune diseases. We can also see MCAS, which is the mast cell activation syndrome. We can see eczema. We can see long COVID syndrome, cancers, diabetes, and so many other issues happening because of the dysbiosis in the gut. Low-dose naltrexone plays well with other medications. It is low dose. It has low side effect, very low drug interaction, and it's very low cost. It can be available in capsules, tablets, sublingual liquids, oral liquids, sublingual troches. We can use transdermal gels. We can use eye drops even for some of those issues associated with the eyes. We can even use topical creams as needed. So the difference between a transdermal gel and a topical cream is a transdermal gel will actually give you a systemic action. It is delayed by about 2.5 hours when we're dealing with naltrexone. But the transdermal gel will literally transverse the epidermis and into the dermis, into the capillary system, and then delivered throughout the body. Whereas topical creams usually are designed, that base of cream is only going to stay on the first few layers of the skin. So you won't necessarily get a full systemic activity. That's the difference there. So we can use low-dose naltrexone orally and topically to help with an issue on the skin, for example. So it's not uncommon that due to a fungal overgrowth, we would see a rash, even a psoriatic plaque that can be very inflamed. It's very itchy. So we can use topical LDN in a cream base to help reduce that inflammation and that itching, because it will block the TLR9 receptor on the outside of that cell. But then we can also use it orally to work internally to hit toll-like receptor 4 and 10 especially. So it does work very well. And we've developed a wide variety of titration kits in a variety of dosage forms, and developed patient educational materials to go along with that, to again aid the patient in understanding what the process is and using low-dose naltrexone to help them find their successful dose, because all doses of LDN are individualized. There isn't a typical routine that we use. There isn't a typical protocol for dosing. It's all about that individual. So here we are. It's been a whirlwind few minutes here. If you have any questions, if I can clarify anything for you, I'd be more than happy to do so. You can reach me on social media. I'm at the LDN Pharmacist. You can also reach me at Makers Compounding or Makers Pharmacy. This is my specific email that will come directly to me. That's mmoser@revcustomrx.com. And this is my cell phone if you'd like to text any questions you may have. Please feel free to get a hold of me anytime. I'd be more than happy to assist. Thank you again for attending, and I look forward to seeing you again. We hold these seminars every month, and so there's a variety of topics that we will address, and they'll be out there on our YouTube channel, the Makers Pharmacy channel. You can also find us at the Revelation Pharma Institute, as well as the Rev Custom RX Institute. Thanks so very much. I appreciate you being with me, and we'll see you next time.